up, friends? Welcome back to KimmyDTV, tips and tricks living your best life. In this video, I'm going to be going over how to pass your med pass. So this is similar to the video that it probably already came out or it's about to come out. It's very similar to the video of how to pass when state comes, but this is basically how to pass your med pass. So that's basically when you are initiated into a new facility 9 times out of 10 before they say, okay, we're going to give you your first shift. Some facilities, what they do is that they have the supervisor come watch you do medications and treatments just so that they know that you're administering it safely. And whether you've been a nurse for years or you just graduated, it's good to brush up on these skills. So these are a few tips that can help you. So if that interests you, don't forget to hit the like button. Don't forget to hit subscribe and hit the notification bell so that you guys never miss a video. First tip I want to give you guys is that make sure that you are cool with your preceptor if you can be. Make sure that you're cool with them so that they give you pointers on how to pass. Like they'll tell you, oh, this supervisor is going to do your med pass. Make sure she likes stuff done this way, so that you get that extra, that extra tip in there. So make sure you're cool with your preceptor. Choose someone that is easy. What I mean, like choose a patient that doesn't have a behavior issue, and choose a patient that you can group stuff together. So 9 times out of 10, like you could ask your supervisor or whoever is going to test you, like, do you have a sheet where you are going to test me on? So 9 times out of 10 she will give you the sheet, like, okay, yeah, here's the sheet that I'm going to test you on, and then you can go home at night, read it through, and make sure that you tick off all those boxes and make sure that you're doing all those tasks correctly. So like, for example, when she gave me my sheet, some of them were like, oh, did you fill in when you're giving liquid medication? Did you make sure you put it on a flat surface and look at it eye level? Did you do this when you're doing G-tube, blah blah blah? So I was able to look at that sheet and be like, okay, this is what she's grading me on, and look the night before, maybe read up a passage about it on your old nursing textbook, or go on YouTube and research, or website, whatever, and know what to do and what to expect so that you don't just go in there and you don't know what's going on. So make sure you batch all your patients. Like, for example, she's gonna probably want to see an inhaler. He or she's probably gonna want to see an inhaler, an injection, eye drop. So if it's all one patient, that's 10 times easier for you. But make sure, like, as nurses, we could be doing it for so many years, or we could be just going to school, or we could just be nervous, we forget. But make sure you know how many minutes you wait after you give one eye drop. Like 5 minutes, you wait 5 minutes after you give the other eye drop, and that you make sure you knock on the door, introduce yourself, check patient, like ask them what their name is, check their wristbands, check their MAR number, check on the computer, do your three triple checks. Make sure you're checking when you're giving the medication, make sure it's the right milligrams, and even sometimes it's written small, give 2 tabs. The supervisor can be looking for all of that. Make sure it's the right patient. Oh, for the love of God, make sure it's the right patient. So you're gonna want to make sure you do that, because some supervisors are more lenient if you make a mistake, but some supervisors are just mean and like, oh no, you're not ready, I'll just choose somebody else. Trust me, I've experienced both. So that's why I'm saying, like, that's why it's good to be good with your preceptor, so that you know like what kind of supervisor is going to test you, and like how how to gauge it, you know what I mean? Treatments, that is the most annoying thing, because you have to wash your hands like a million gazillion times. Make sure, like, for me, what I did when I did my treatments is I told her out loud what I was doing. Like, okay, right now I'm going to be washing my hands, right now I'm going to be doing this, right now I'm going to be doing that. Like, I would just talk her through it, and while I'm talking her through it, I'm actually talking myself through it, so that I do not miss a step. Because with treatments, you got to be sterile, you got to wash your hands a million times. So make sure you follow all of that, because that's infection control and everything. So you're going to want to let your supervisor know that, hey, I know what I'm doing. With G-tube meds especially, G-tube meds can be tricky, like how much water you put in between, how you crush them, that it's in separate cups. Like, because I know some nurses, like if some nurses do it for many years and they just dump everything. Like, no, this is not the time to do it. Your supervisor wants to know, like, if state comes, like, or in general, are you giving safe care to the patients. So make sure that it is being done correctly. One thing I actually did is with my orientator, with the treatments, even though I've been doing treatments for a long time, I asked my orientator, can you do a treatment in front of me, like the treatment that I wanted to do in front of my supervisor? Can you do it in front of me first and then I'll do it? And then she did it for me, and that really helped me tremendously, because sometimes like you have to see it. Like it's not enough just to read it or to watch it on YouTube. Sometimes you have to see it and actually assist to do it correctly. Even if you do it all those years, like sometimes, like I'm not gonna lie, like I'm somebody, like I don't like people like breathing over my neck like that, because it's like, you know, yeah, it's easy to say if you know what you're doing you shouldn't be scared or whatever, but like in the moment when you're nervous and you know you have to pass, oh my god, it's your livelihood, whatever, you need this job, whatever, you know, you could be really kind of nervous. So that's annoying. So that's why I'm saying, like, you just have to make sure you ask for help. Don't think you know everything. Even if you've been a nurse for 20 years, like, just ask for help to make sure that you pass. You never know what kind of supervisor you're gonna get. You never know how tough they are, whatever. So make sure you know. Alright guys, so that is my advice on how to pass your medication checklist. I hope you guys pass, because I really guys want you to get out there, start working, to start getting your experience, to start making your money so that you can make your dreams come true and move on to the next level. But this is the first start. This is the first step. It requires you to humble yourself. It requires you to pay attention and just have confidence at the end of the day. And yeah, I wish you guys the best of luck. And thank you guys so much for watching. Don't forget to hit the like button, subscribe, hit the notification bell, and I'll see you guys later. Bye!